Hello, this is Breakfast with John Kay and NAGA Munchetty.
New claims that some hospitals are dangerously understaffed. Hello there, good morning. It's Sunday, the 3rd of February.
Also to come.
And Ben Rich has the weather. Good morning, Ben. Thank you.
Let's get to our main story. There are new claims by some nurses that staffing levels in parts of the NHS are dangerously low.
Yes, a survey of nearly 600 nurses by Nursing Times found that 3/4 of them had witnessed what they considered to be poor care in their ward or unit over the last year. And in a few minutes, we're going to be speaking to Janet Davis, who's from the Royal College of Nursing, about this story. That will be in about 10 minutes' time.
Now, one of Britain's biggest food distribution companies has withdrawn a range of halal products after traces of pork were found in food that it supplies to prisons.
It's the company 3663 also delivers to hospitals, schools, care homes, hotels, cafes, and the Food Standards Agency is now investigating whether the meat has been distributed more widely in the UK.
David Cameron is preparing for 2 days of talks with the leaders of Afghanistan and Pakistan.
Here, 8 more people have been arrested by police investigating the murder of a teenager in London a week ago.
A woman from East London who was disfigured when acid was thrown in her face has spoken about the assault in the hope that it will help police catch her attacker.
This 20-year-old Naomi Oni says she was attacked by a woman wearing a hijab. No arrests have been made, but police say inquiries are continuing.
A working pleasure pier in Cleethorpes has failed to reach its guide price of £400,000 at auction.
Yes, the pier is one of the UK's shortest and has been part of the seaside resort's architecture for more than 140 years. So what's going to happen to it now? Back on the market, maybe, or lower the price? What do you do with a pier you can't sell?
Develop it.
Maybe.
Maybe. Those are the main stories this morning. Ben's going to have the weather in about 10 minutes.
Now, let's go back to that story you mentioned a moment ago. More than half of nurses questioned in an online poll believe their NHS ward or unit is dangerously understaffed.
The Nursing Times spoke to 600 workers. 3/4 also said that they'd witnessed what they considered poor care in the last year. Let's talk to Janet Davis, who's Director of Nursing at the Royal College of Nursing and joins us from our London studio. Thank you very much for joining us. For anyone listening or watching this morning, they're going to be really concerned. What's your impression of this research done by the Nursing Times? Patients, what evidence do you have of this?
Well, what we're finding from...
Let me just give you the view from the Department of Health. A spokesman there has said that there are actually more clinical staff working in the NHS now than there were in May 2010. 2,500 new nurses began working in the NHS in October of last year alone. But it's also saying that there are 300,000 nurses, midwives and health workers overall in the NHS. But the way that patients are being treated is changing. So staffing levels in hospitals need to reflect that, i.e. there's more community care rather than it all being hospital-based. What do you make of that? Janet Davis from the Royal College of Nursing, thank you very much for taking the time to talk to us this morning.
It's coming up to 7:15. You're watching Breakfast on BBC News. Good morning. Main story today. Let's have a look at the Sunday weather. This weekend.
This way.
Where has he gone?
I'm over here. Hello.
Oh, I didn't forecast that, Ben, obviously, correctly. There's